Well, Israeli Prime Minister Benjamin Netanyahu's office has announced that Gaza's Rafah border crossing will remain closed until further notice. It added that the reopening will depend on Hamas returning the bodies of deceased hostages in Gaza. Meanwhile, people are taking stock of what's left of the medical facilities there. Many hospitals have been destroyed. Thousands need urgent care, and there is the risk of outbreaks of life-threatening diseases like cholera and tuberculosis.
Desperately needed medical supplies coming into Gaza, part of an effort to make treatment available after months of sealed borders, providing hospital beds and trauma wards for a population sorely in need of care. Across Gaza, hospitals are overcrowded and many are damaged, leaving patients in makeshift quarters. There's a backlog of cases, people waiting months for urgent care.
My son developed severe infections. They built up, and we lost his right eye. He's also suffering from malnutrition. Hassan has been injured for about 2.5 months. He used to weigh 65 kilos, and now he's around 35 or 40 kilos.
Many hospitals are destroyed beyond repair. This used to be Shifa Hospital in Gaza City. And this used to be a children's hospital. The World Health Organization says only 13 hospitals are currently partly functional for a population of 2 million people. It may take decades to rebuild, but the population faces massive health challenges now.
The outbreaks of infectious diseases are spiraling out of control, whether meningitis, Guillain-Barré syndrome, diarrheas, respiratory illnesses. We're talking about a mammoth of a work. It's huge. It's huge. The amount of work that needs to be done in Gaza is unimaginable to me, and I think we're going to have to take it step by step.
About 15,000 patients with the most dire problems are waiting to be evacuated through the Rafah crossing to Egypt.
I'm waiting for the crossings to open. I've been working on an application for my son. His tendons are torn, his nerve is severed, his left leg has been amputated. God willing, the crossings will open.
For the most urgent cases, the only way to get better is to leave Gaza.
We can go to Gaza now and speak to Amjad Shawa. He's head of the Palestinian NGO network. Welcome back to DW. So now it's been over a week now. We're over a week now into the ceasefire between Israel and Hamas. Could you tell us what you've observed in this week in terms of the humanitarian situation in Gaza?
Thank you. The big change, it's the ceasefire itself. The airstrikes and the daily killing of the Palestinians, which is partially stopped. Yesterday, there was 10 people were killed from one family, killed in the what's called the yellow line. And the Israel has no mercy to kill these 10 members of the family, children, women, elders, who were together beside this line. So about the humanitarian aid, which is still very limited amount comparing to the needs that Gazans are asking for, due to 2 years of the intensive destruction of the food resources, of the social economic infrastructure. About 90% of the population dependent on humanitarian aid. 93% were displaced, and nowadays we are need for 300,000 tents that these displaced people to be sheltered. And now it's winter time, and I'm sorry to say that for all the people that we have just a few thousands which allowed to enter, and very limited amount of these tents and other supplies, blankets, mattresses, and the needs for the people. At the same time, the health facilities, which is out of service, and there is severe shortage of aid supplies. And the Israeli announcement to postpone the opening of Rafah crossing, which is something that people will receive by shock and by sadness. 18,000 people of patients, injured people who are severely suffering.
I wanted to ask you. I'm sorry to interrupt. I wanted to ask you specifically about the announcement from Netanyahu's office that the Rafah border crossing will stay closed until further notice. What do you envisage will be the specific impacts of this on your work?
It will have severe impacts, and really that these people who are phoning us every day regarding their medical evacuation to outside through Rafah crossings now, to further notice there will be no improvement on their health conditions. We could lose so many of these lives because of this ignorance by the Israelis towards the suffering of these people, which caused by Israel, by the destruction of the hospitals, by killing the doctors and medical teams. And this is something we are suffering from shortage of medications and medical supplies, 60%. So it's really will be critical implication in our work, but it's more on the health of the people who are in bad need to have medical evacuation. Israel till now didn't respect its commitment according to the humanitarian protocol to open the 6 crossings. We have only 2 crossings, which is working partially and with very limited amount of the supplies, whether food and medicines.
Thank you so much for your time today. So that was Amjad Shawa, head of the Palestinian NGO network, speaking to us from Gaza. Thank you.
Thank you.
Now let's bring in Yousra Abu Sharekh. She's the Gaza Program Coordinator for the International Network for Aid, Relief and Assistance, also known as INARA, in Gaza. Yousra, can you describe the current conditions in Gaza's remaining hospitals?
Yeah, actually, the situation on the ground, especially the already collapsed healthcare system before the war, is catastrophic. We are talking about like depleted medical supplies and consumables. We are talking about drained and overused equipment, medical equipment. And also we are talking about drained and exhausted healthcare staff who were been working for 24 months in row, non-stopping. So the hospitals who are still partially functioning are not capable or are not equipped to deal not only with the injuries or the patients, but also with the cases that are in need for advanced and tertiary care, and they are in dire need and urgent need to be evacuated outside Gaza Strip. Also, we are talking about at least 42,000 cases who are with life-altering and life-changing injuries who are also in need for advanced care that is not available in the Gaza Strip. So yes, we are facing a very serious crisis in the healthcare system in Gaza that affecting and that results in losing more lives if there is no actions taken.
Now, is the aid infrastructure, including from other NGOs, getting back up to speed?
Yes, a bit. We are talking about like very few hundreds of trucks are getting into Gaza Strip, but unfortunately they are not enough to meet the dire need on the ground. Especially we are talking about at least 7 months of blocking and closing all the borders. So people now are in need of it for every single item, especially the sheltering items and materials. We are talking about a huge destruction in Gaza City and North, and also Eastern Khan Yunis. So people are, and we are talking about like winter is coming. So if there's no sheltering materials entering, and also hygiene in addition to food. So the needs on the ground is huge, and the crisis is ongoing. The people are desperate with maybe they feel the glimpse of hope after the ceasefire, but unfortunately this crisis is continuing, emerging, and revealing more and more suffering for people. So we also need to scale up in psychosocial and mental health support because people, especially children, went through complex trauma for 2 years. So we need also to scale up to support those children dealing with their trauma and with their losses as well, to go back gradually to the normality and to the normal life if this ceasefire is permanent, hopefully.
Thank you very much. Yousra Abu Sharekh, Gaza Program Coordinator for International Network for Aid, Relief and Assistance. Thank you very much for your time. Tess Ingram is a spokeswoman for the United Nations Children's Organization, UNICEF, and joins us now from Gaza. Tess, is UNICEF back in Gaza and operating on full steam?
We never left Gaza. We've been here the whole time and we've been bringing in aid to the Gaza Strip since May, but it hasn't been all types of aid. There's certain items that have been restricted. And of course, it hasn't been in sufficient enough quantities. We were hoping that this ceasefire would present us with the opportunity to scale up to the level that children in Gaza need. But we are seeing an increase, but it's not yet enough. It's not making a difference on the ground in the lives of the women and children who continue to suffer here in Gaza.
Well, what is the humanitarian situation that you have found now that the bombing has stopped?
Of course, we've still got a famine confirmed in Gaza City. I was just up there a few days ago talking to families about how they continue to search for food, how food in the market can remain expensive and out of reach, and they really need the volume of food aid, but also nutrition treatments that UNICEF provides to come into the Gaza Strip at scale to address that challenge. Water was also a really big issue. Families doing that universal sign for drinking water as we drove through parts of Gaza City that have been decimated. And I think we talk a lot about the destruction of homes, which is severe. 9 in 10 homes in the Gaza Strip have been damaged or destroyed. But it's also the systems that sustain life around those homes, like water systems, that have sustained such damage, and it will make it difficult for people to remain in those areas and to rebuild unless we can get those systems back up and running as well.
Now, are Israeli authorities facilitating the distribution of humanitarian and medical aid?
We're getting some aid into the Gaza Strip. UNICEF has brought in hundreds of pallets in the last few days, but we still need to see a larger scale up in the volume of aid. And to do that, we are calling for all available crossings into the Gaza Strip to open. At the moment, we're operating primarily through Kerem Shalom, a crossing in the south, and a secondary crossing in the middle area. But we need crossings in the north of the Gaza Strip to open so that we can bring aid in directly to the people there in northern Gaza. And of course, Rafah in the south is a key crossing for both aid and for the movement of people.
How do you see the situation developing in the medium term?
We really need this ceasefire to hold. The stakes are so high. The level of need on the ground is immense in terms of health, in terms of children's malnutrition, in terms of their need for education and mental health support. And winter is right around the corner, which really it's a race against the clock to make sure that families have what they need for the coming colder and wetter months: shelter, blankets, winter clothes for children. So I see the coming weeks as a really precarious but important time where we need this ceasefire to hold so that we can scale up this, not just the entry of supplies, but also the life-saving services that UNICEF provides to children here in the Gaza Strip.
Tess Ingram there from UNICEF in Gaza. Thank you very much.